I want to just give you a basic explanation of some biology. So when we're really small, we start out as a single cell, and that cell divides into a bunch of other cells. And eventually, after a lot of cell divisions, you have a baby, right? And that baby over time, over the years, gets bigger. And at some point, the baby stops growing. Anybody that has a teenager is familiar with this concept. They get bigger and they get bigger and they outgrow their shoes and clothes and everything else. Then one day they stop growing. Well, how does an organism stop growing? It's not magic. There are actually cellular switches that turn off cell division, that tell cells to stop dividing and stop making that organism get bigger. And those switches are called tumor suppressor genes. And if any given cell, that tumor suppressor gene stops working, either through a mutation or some other problem, then that cell will keep dividing. And if that cell keeps dividing, it can form a tumor. Okay. Well, if that cell that keeps dividing is a Schwann cell, that insulation cell within a nerve fiber, it will form a schwannoma. Okay. If that cell is on a different structure that forms something called neurofibromin, just a different structural element of the cell, of the nerve rather, that is on chromosome 17, and that can form a neurofibroma. Okay. Now these are just bundles of cells that grow. They're not cancer. They don't spread and metastasize and go elsewhere. They just form a localized ball of cells inside the nerve. And that's what a nerve sheath tumor is. Usually they're benign. There are very rare times where these can form malignant peripheral nerve sheath tumors. We'll talk a little bit about that later. But for the most part, these are benign tumors that just grow locally and don't spread around. Now, some patients have a loss of that tumor suppressor gene in the original cell where the sperm and the egg fertilize and form that original single cell that then divides and forms the organism. Well, if at any point along that process, one of those cells loses the tumor suppressor gene, then every cell in the body descended from that cell will potentially form tumors. So if it's the original zygote, then every Schwann cell in the patient's body may form a schwannoma, or every neurofibromin containing cell can form a neurofibroma. But sometimes only a single cell can form those tumors. And eventually, when the person grows up, maybe just one cell loses that tumor suppressor gene, and they will have a solitary schwannoma or neurofibroma, which means that's the only one they'll ever get. Okay. Patients that have schwannomatosis can get schwannomas at multiple locations in their body. Okay. Persons with neurofibromatosis can not only get neurofibromas, but they also have this whole host of other issues that can occur, these structural problems, cutaneous lesions, cafe au lait spots, axillary freckling. There's a number of bony and eye and dural and brain abnormalities. Again, a little bit too extensive for us to get into today, but just understand that there are different syndromes that can give rise to peripheral nerve sheath tumors. And there are also patients who don't have a syndrome such as these that can also develop nerve sheath tumors simply because an individual cell has lost that tumor suppressor gene and it forms the tumor.